Question 1. Research into the most effective strategies for preventing the transmission of multi-drug-resistant organisms, MDRO, in a pediatric intensive care unit, PICU, has highlighted several approaches. A nurse is caring for a neonate with a known MRSA colonization who is also experiencing respiratory distress, requiring frequent suctioning. The nurse is concerned about preventing the spread of MRSA to other vulnerable infants in the unit. Which of the following actions best aligns with current U.S. regulatory frameworks and professional guidelines for infection control in this setting? Option A. Relying on the routine cleaning protocols of the unit, as the neonate is already colonized and the primary focus is on managing respiratory distress. Option B. Educating the parents on MRSA and advising them to wash their hands thoroughly before visiting, but not requiring them to wear gowns or gloves. Option C. Implementing strict contact precautions, including the use of gloves and gowns for all direct patient care and environmental cleaning, and ensuring meticulous hand hygiene before and after patient contact. Option D. Using alcohol-based hand sanitizer exclusively before and after patient contact, as it is quicker and more convenient than soap and water. The correct answer is C. Implementing strict contact precautions, including the use of gloves and gowns for all direct patient care and environmental cleaning, and ensuring meticulous hand hygiene before and after patient contact. Explanation: this scenario is professionally challenging because it requires balancing immediate patient needs with the long-term goal of preventing healthcare-associated infections, which are a significant concern in pediatric care. The nurse must consider the specific vulnerabilities of pediatric patients, such as immature immune systems and the potential for rapid deterioration. Careful judgment is required to implement infection control measures effectively without compromising the quality of care or causing undue distress to the child and family. The correct approach represents best professional practice because it prioritizes evidence-based protocols for infection control, aligning with guidelines from organizations like the Centers for Disease Control and Prevention, CDC, and the Association for Professionals in Infection Control and Epidemiology, APIC, which are foundational for U.S. healthcare settings. Adhering to these guidelines, such as proper hand hygiene, isolation precaution, and environmental cleaning, is mandated by regulatory bodies like the Joint Commission and state health departments to ensure patient safety and prevent the spread of pathogens. This approach demonstrates a commitment to patient well-being and adherence to professional standards of care. An incorrect approach that focuses solely on the immediate comfort of the child, without adequate infection control measures, fails to uphold the nurse's ethical and legal responsibility to prevent harm. This could lead to the transmission of infectious agents, violating principles of non-maleficence and beneficence. Such an approach would be in direct conflict with federal regulations, e.g., those enforced by CMS for Medicare/Medicaid participation, and accreditation standards that mandate robust infection prevention programs. Another incorrect approach that relies on anecdotal evidence or personal experience rather than established protocols is professionally unacceptable. This deviates from the standard of care and can result in inconsistent or ineffective infection control practices, increasing the risk of HAIs. This would be a failure to adhere to the professional duty of care and could be considered a breach of professional conduct, potentially leading to disciplinary action. A third incorrect approach that bypasses established hospital policies for infection control, even with good intentions, is also problematic. Hospitals have specific policies derived from regulatory requirements and best practices to ensure a standardized and effective approach to infection prevention. Deviating from these policies, without a clear, documented, and approved rationale, undermines the integrity of the infection control program and can create vulnerabilities. This demonstrates a lack of understanding of the systemic nature of infection control and the importance of collective adherence to established procedures. The professional decision-making process for similar situations should involve a systematic approach. 1. Identify the potential risks. Recognize the specific infection risks associated with the patient's condition, the hospital environment, and the procedures being performed. 2. Consult evidence-based guidelines and hospital policies. Refer to established protocols for infection control, such as those for hand hygiene, personal protective equipment, PPE use, and isolation precautions. 3. Assess the individual patient's needs. Consider the child's age, immune status, and specific clinical situation when applying general guidelines. 4. Communicate with the healthcare team. Discuss infection control strategies with physicians, other nurses, and ancillary staff to ensure a coordinated approach. 5. Educate the patient and family. Provide clear and understandable information about infection control measures and their importance. 6. Document interventions. Accurately record all infection control measures implemented. 7. Evaluate and adapt. Continuously assess the effectiveness of infection control measures and adapt as necessary based on new information or changes in the patient's condition. Question 2. The efficiency study reveals that the pediatric unit's response time to children presenting with acute respiratory distress has a significant impact on patient outcomes. A 4-year-old child is admitted with fever, cough, and rapid breathing. Initial assessment suggests a possible diagnosis of pneumonia. The nurse is tasked with developing an immediate nursing care plan. Which of the following nursing actions best reflects an efficient and effective approach to managing this child's suspected pneumonia, considering the need for prompt diagnosis and intervention? Option A. Documenting the child's symptoms and waiting for the physician to provide a definitive diagnosis and specific treatment orders before implementing any interventions beyond basic comfort. Option B. Initiating broad-spectrum antibiotic therapy immediately to cover potential bacterial causes, as this is the most common type of pneumonia in this age group. Option C. Focusing solely on comfort measures like positioning and providing a calm environment, deferring further diagnostic workup until the child's fever subsides. Option D. Administering supplemental oxygen as ordered, ensuring adequate hydration through oral or intravenous fluids, and closely monitoring the child's respiratory rate, oxygen saturation, and overall clinical status for any signs of deterioration. The correct answer is D. Administering supplemental oxygen as ordered, ensuring adequate hydration through oral or intravenous fluids, and closely monitoring the child's respiratory rate, oxygen saturation, and overall clinical status for any signs of deterioration. Explanation. Scenario analysis. This scenario presents a common but critical challenge in pediatric nursing, managing a child with suspected pneumonia where the clinical presentation is complex and potentially mimics other respiratory conditions. The challenge lies in accurately diagnosing the type of pneumonia, initiating appropriate nursing interventions promptly, and ensuring the child's safety and well-being, while adhering to established clinical guidelines and regulatory requirements for pediatric care. The nurse must balance the need for rapid assessment and intervention with the importance of evidence-based practice and patient advocacy. Correct approach analysis. The correct approach prioritizes a comprehensive assessment, including obtaining a detailed history, performing a thorough physical examination, and collaborating with the healthcare team to order appropriate diagnostic tests. This aligns with the nursing scope of practice and the regulatory framework governing pediatric nursing, which emphasizes patient safety, accurate diagnosis, and evidence-based interventions. Promptly initiating supportive nursing care, such as oxygen therapy, hydration, and comfort measures, based on the suspected diagnosis and physician orders, is crucial for stabilizing the child and preventing complications. Continuous monitoring of vital signs and respiratory status is paramount, allowing for timely adjustments to the care plan. This approach reflects best professional practice by ensuring a holistic and individualized care plan that addresses the child's immediate needs and potential risks. Adhering to the principles of safe and effective pediatric nursing care, as outlined by professional nursing organizations and regulatory bodies. Incorrect approaches analysis. One incorrect approach involves delaying definitive diagnostic measures and relying solely on symptomatic treatment without a clear understanding of the underlying pneumonia type. This could lead to inappropriate interventions, delayed effective treatment, and potential worsening of the child's condition, violating the ethical principle of beneficence and potentially breaching standards of care. Another incorrect approach might be to administer broad-spectrum antibiotics without physician orders or a confirmed bacterial infection, which can contribute to antibiotic resistance and is outside the scope of independent nursing practice, representing a regulatory and ethical failure. Furthermore, neglecting to monitor the child's respiratory status closely after initial interventions could result in missed signs of deterioration, a failure to uphold the duty of care, and potentially leading to adverse outcomes, which is a significant ethical and professional lapse. Professional reasoning. Professionals should employ a systematic approach to patient care, beginning with a thorough assessment and moving through diagnosis, Planning, implementation, and evaluation. This process is guided by clinical judgment, evidence-based practice, and adherence to regulatory standards. In situations involving potential respiratory compromise in a child, nurses must maintain a high index of suspicion, prioritize safety, and communicate effectively with the interdisciplinary team. They should be proficient in recognizing signs and symptoms of various types of pneumonia and understand the appropriate nursing interventions for each. Continuous learning and staying abreast of current guidelines are essential for providing optimal pediatric care. Question 3. Market research demonstrates that parents of newborns often seek information on optimal infant care practices. A certified pediatric nurse, CPN, is educating new parents about the developmental physiology of their newborn. Which of the following approaches best reflects an understanding of the immature state of major organ systems in a neonate and its impact on care? Option A. Recommending a neutral thermal environment, careful monitoring for signs of feeding intolerance, and explaining that the neonate's immature gastrointestinal system requires smaller, more frequent feedings of easily digestible milk. Option B. Emphasizing the importance of establishing a consistent feeding schedule with large volumes of formula to ensure adequate caloric intake, and advising parents to dress the baby in light clothing to prevent overheating. Option C. Suggesting that the newborn can tolerate a wide range of environmental stimuli and encouraging parents to expose the baby to various sounds and sights to promote sensory development. Option D. Advising parents to rely on the newborn's innate ability to regulate body temperature and to avoid unnecessary interventions unless the baby shows obvious signs of distress. The correct answer is B. Emphasizing the importance of establishing a consistent feeding schedule with large volumes of formula to ensure adequate caloric intake, and advising parents to dress the baby in light clothing to prevent overheating. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified pediatric nurse, CPN, to interpret and apply knowledge of developmental physiology to a clinical situation involving a neonate. The nurse must recognize that the immature state of various organ systems in a neonate significantly impacts their response to stimuli and their ability to maintain homeostasis. This necessitates a nuanced approach that goes beyond standard adult care protocols and considers the unique vulnerabilities of this age group. Correct approach analysis. The correct approach involves prioritizing interventions that support the neonate's immature thermoregulatory system and minimize metabolic demands. This aligns with the understanding of neonatal developmental physiology, specifically the limited subcutaneous fat, larger surface area to body mass ratio, and underdeveloped brown adipose tissue, all of which contribute to heat loss. Furthermore, the immature gastrointestinal system's limited capacity and slower motility necessitate careful feeding strategies. By focusing on maintaining a neutral thermal environment and providing appropriate, easily digestible nutrition, the CPN is directly addressing the physiological limitations of the neonate, thereby promoting stability and preventing complications. This approach is ethically grounded in the principle of beneficence, ensuring the neonate receives care tailored to their developmental stage to promote well-being and prevent harm, consistent with the standards of pediatric nursing practice. Incorrect approach is analysis. One incorrect approach would be to administer standard infant feeding protocols without considering the neonate's immature gastrointestinal tract. This fails to acknowledge the slower gastric emptying, reduced enzyme production, and underdeveloped intestinal motility characteristic of neonates. Such an approach could lead to feeding intolerance, aspiration, or inadequate nutrient absorption, violating the principle of non-maleficence by potentially causing harm. Another incorrect approach would be to assume the neonate can regulate their body temperature as effectively as an older child or adult. This overlooks the physiological immaturity of the neonatal thermoregulatory system, including the limited ability to shiver and the reliance on non-shivering thermogenesis, which can be depleted. Failing to provide external warming measures or a neutral thermal environment could lead to hypothermia, increasing the risk of metabolic acidosis, hypoglycemia, and respiratory distress, thus failing to uphold the duty of care. A third incorrect approach would be to expose the neonate to excessive environmental stimuli, such as loud noises or bright lights, without considering their immature sensory processing capabilities. Neonates have a limited ability to filter stimuli, and overstimulation can lead to increased metabolic expenditure, stress, and disorganized behavior, hindering their ability to rest and recover. This demonstrates a lack of understanding of the developing neurological system and its impact on overall well-being. Professional reasoning. When faced with a neonate, a CPN should employ a decision-making process that begins with a thorough assessment of the infant's developmental stage and its implications for each major organ system. This involves recalling and applying knowledge of normal developmental physiology. The nurse should then consider the specific clinical context and potential risks associated with the infant's immaturity. Interventions should be selected based on their ability to support physiological functions that are not yet fully developed, thereby promoting homeostasis and preventing complications. This requires a proactive approach, anticipating potential problems arising from developmental limitations and implementing preventative measures. Continuous reassessment and adaptation of care based on the infant's response are crucial. Question 4. Which approach would be most effective in addressing potential developmental delays in a pediatric patient during a routine well-child visit, considering both the need for thorough screening and the practicalities of a busy clinic? Option A. Conducting a brief, informal observation of the child's motor skills without using a standardized tool or asking specific questions about developmental milestones. Option B. Relying solely on parental verbal reports of their child's development without using a standardized assessment tool. Option C. Administering a validated developmental screening tool and engaging parents with open-ended questions about their child's milestones and behaviors, followed by appropriate referrals if concerns arise. Option D. Waiting for overt signs of significant developmental delay before initiating any formal screening or assessment. The correct answer is C. Administering a validated developmental screening tool and engaging parents with open-ended questions about their child's milestones and behaviors, followed by appropriate referrals if concerns arise. Explanation. Scenario analysis. This scenario presents a common challenge in pediatric nursing, ensuring timely and accurate developmental screening in a busy clinic setting where parental concerns may be subtle or difficult to articulate. The challenge lies in balancing the need for comprehensive screening with time constraints and varying levels of parental engagement, while adhering to established pediatric developmental guidelines. Correct approach analysis. The correct approach prioritizes a systematic, evidence-based method that integrates screening into routine care. This aligns with recommendations from organizations like the American Academy of Pediatrics (AAP), which advocate for routine developmental surveillance and screening at well-child visits. Utilizing a standardized, validated screening tool, e.g., ages and stages questionnaires, parents' evaluation of developmental status, allows for objective assessment and early identification of potential delays. Furthermore, actively engaging parents by asking open-ended questions about their child's development and providing clear, actionable information empowers them and facilitates early intervention. This approach is ethically sound as it upholds the principle of beneficence by acting in the child's best interest and promotes patient autonomy by involving parents in their child's care. It also adheres to professional standards of practice for pediatric nursing. Incorrect approaches analysis. One incorrect approach involves solely relying on parental reports without utilizing a standardized screening tool. While parental input is crucial, it can be subjective and influenced by various factors, potentially leading to missed developmental concerns. This failure to employ objective measures can be seen as a breach of professional duty to provide comprehensive care and may not meet the standards set by regulatory bodies for developmental screening. Another incorrect approach is to defer screening until a significant developmental delay is overtly apparent. This reactive approach contradicts the proactive nature of developmental screening, which aims to identify issues at their earliest stages when interventions are most effective. Delaying screening can lead to missed opportunities for early intervention, potentially impacting the child's long-term developmental trajectory and violating the ethical principle of timely care. A third incorrect approach is to administer a screening tool but fail to follow up on results or provide appropriate referrals. The purpose of screening is to identify potential issues and initiate a pathway for further assessment and support. Neglecting to act on screening results renders the screening process ineffective and can be considered a failure to provide adequate care, potentially leading to adverse outcomes for the child and a violation of professional responsibilities. Professional reasoning. Professionals should approach developmental screening by integrating standardized tools into routine well-child visits, actively engaging parents with open-ended questions, and ensuring timely follow-up and referrals based on screening results. This systematic, proactive, and collaborative approach maximizes the likelihood of early identification and intervention, thereby promoting optimal child development and adhering to ethical and regulatory standards. Question 5. Regulatory review indicates that a 6-month-old infant presents with increased irritability, poor feeding, and diaphoresis during feeding. The infant has also been noted to have a slight cough and has been less active than usual. The nurse is assessing the infant. Which of the following actions is the most appropriate next step in the management of this infant? Option A. Reassure the parents that these symptoms are likely due to a common viral illness and advise them to monitor for fever. Option B. Administer a dose of a loop diuretic as prescribed for suspected heart failure. Option C. Perform a thorough cardiac and respiratory assessment, review the infant's growth and feeding history, and notify the physician for further evaluation. Option D. Focus on assessing the infant's oral intake and hydration status, as feeding difficulties are the primary concern. The correct answer is C. Perform a thorough cardiac and respiratory assessment, review the infant's growth and feeding history, and notify the physician for further evaluation. Explanation. Scenario analysis. This scenario presents a professionally challenging situation because it requires the pediatric nurse to rapidly assess a young child exhibiting symptoms that could indicate a serious, life-threatening condition like heart failure. The challenge lies in differentiating these symptoms from more common pediatric ailments, ensuring timely and appropriate intervention, and communicating effectively with the family about a potentially grave diagnosis. The nurse must balance the urgency of the situation with the need for accurate assessment and avoid unnecessary alarm, while still conveying the seriousness of the findings. Correct approach analysis. The correct approach represents best professional practice by prioritizing a comprehensive assessment of the child's cardiac and respiratory status, coupled with a thorough review of the child's medical history. This aligns with the American Nurses Association (ANA) Code of Ethics, which emphasizes the nurse's responsibility to provide competent, compassionate, and ethical care. Specifically, Provision 1 states the nurse practices with compassion and respect for the inherent dignity, worth, and unique attributes of each person. This includes a thorough assessment to identify the root cause of the child's distress. Furthermore, adherence to evidence-based practice guidelines for pediatric cardiology, such as those published by the American Academy of Pediatrics (APA) or the American Heart Association (AHA), mandates a systematic approach to diagnosing and managing suspected heart failure. This involves looking for a constellation of signs and symptoms, not just isolated findings, and considering differential diagnoses. Promptly notifying the physician for further evaluation and management is crucial, as it ensures the child receives timely medical intervention and diagnostic testing, which are critical for positive outcomes in pediatric heart failure. Incorrect approaches analysis. One incorrect approach involves dismissing the symptoms as a common viral illness without a thorough cardiac and respiratory assessment. This fails to meet the standard of care and violates the ANA Code of Ethics, particularly Provision 4, which states the nurse has authority and responsibility for nursing practice and determines the appropriate delegation of tasks consistent with the nurse's obligation to promote health and provide optimal care. Overlooking potential cardiac issues due to a perceived commonality of symptoms is a failure in professional judgment and could lead to delayed diagnosis and treatment, resulting in significant harm to the child. Another incorrect approach is to immediately administer a diuretic without a physician's order or a confirmed diagnosis of heart failure. This is a direct violation of nursing scope of practice and patient safety protocols. The Nurse Practice Act in most U.S. jurisdictions clearly defines the boundaries of nursing practice, which generally prohibits administering prescription medications without a valid order from an authorized prescriber. Furthermore, administering a diuretic without a confirmed diagnosis could mask symptoms, delay appropriate treatment, and potentially cause harm through electrolyte imbalances or dehydration. This approach demonstrates a lack of critical thinking and a failure to follow established medical protocols. A third incorrect approach is to focus solely on the child's feeding difficulties without considering other systemic signs. While feeding difficulties can be a symptom of heart failure in infants, They are also common in many other pediatric conditions. A comprehensive assessment must encompass a broader range of signs and symptoms, including respiratory distress, poor weight gain, diaphoresis, and edema, to accurately identify or rule out heart failure. Relying on a single symptom is insufficient for diagnosis and can lead to misdiagnosis and delayed care, which is ethically unacceptable and contrary to best nursing practice. Professional reasoning. Professionals should employ a systematic decision-making framework that begins with a thorough and focused assessment based on the presenting signs and symptoms. This involves utilizing clinical judgment, applying knowledge of pediatric physiology and common pediatric illnesses, and consulting available evidence-based resources. The next step is to synthesize the assessment findings to formulate a differential diagnosis, considering the most serious potential conditions first. Prompt and clear communication with the physician is paramount, presenting objective data and a reasoned assessment. This collaborative approach ensures that diagnostic and therapeutic interventions are initiated in a timely and appropriate manner, always prioritizing patient safety and well-being in accordance with regulatory requirements and ethical principles. Question 6. Cost-benefit analysis shows that early identification of respiratory distress in neonates significantly reduces morbidity and mortality. A certified pediatric nurse is assessing a 3-day-old infant who is exhibiting mild nasal flaring and occasional grunting sounds during respiration. The nurse has reviewed the infant's birth history and notes no significant complications. Which of the following approaches best reflects an understanding of pediatric anatomy and physiology in this scenario? Option A. Reassure the parents that these sounds are common in newborns and monitor the infant's feeding patterns. Option B. Auscultate the infant's lungs for breath sounds, assess respiratory rate and depth, and observe for chest retractions. Option C. Focus solely on the infant's skin color to detect any signs of cyanosis. Option D. Document the grunting sounds as normal physiological variations without further investigation. The correct answer is B. Auscultate the infant's lungs for breath sounds, assess respiratory rate and depth, and observe for chest retractions. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the pediatric nurse to interpret subtle physiological cues in a neonate, distinguishing between normal developmental variations and potential signs of distress. The immature systems of neonates are highly sensitive, and deviations from expected patterns can have rapid and significant consequences. Accurate assessment is paramount to timely intervention and optimal patient outcomes, necessitating a deep understanding of pediatric anatomy and physiology. Correct approach analysis. The correct approach involves a comprehensive assessment of the neonate's respiratory effort, including rate, depth, and presence of retractions or nasal flaring, alongside auscultation of breath sounds. This aligns with the foundational principles of pediatric nursing and the regulatory framework governing safe patient care, which mandates thorough physical assessment to identify deviations from normal. Recognizing the unique respiratory anatomy of neonates, such as their obligate nasal breathing and higher respiratory rates, is critical. This approach prioritizes direct observation and objective data collection, which are essential for accurate diagnosis and treatment planning, thereby upholding the standard of care expected of a certified pediatric nurse. Incorrect approaches analysis. One incorrect approach would be to solely rely on parental reports of the infant's behavior without performing a direct physical assessment. This fails to meet the professional standard of care by neglecting direct patient evaluation, which is a core competency. Ethically, it could be considered a breach of duty of care, as the nurse is responsible for independently assessing the patient. Regulatory frameworks for nursing practice emphasize the nurse's responsibility for direct patient assessment and the use of clinical judgment based on objective findings. Another incorrect approach would be to dismiss any audible crackles as normal lung sounds in a neonate without further investigation. Neonatal lungs are developing, and while some sounds may be transient, persistent or concerning crackles can indicate underlying pathology such as pneumonia or fluid overload. Failing to investigate these findings further represents a failure to apply critical thinking and a potential violation of the nursing scope of practice, which requires nurses to assess and respond to abnormal findings. A third incorrect approach would be to focus exclusively on the infant's skin color without assessing other vital signs and respiratory mechanics. While cyanosis is a critical sign, it is often a late indicator of respiratory compromise. A comprehensive assessment must include multiple physiological parameters to provide a complete picture of the infant's status. Relying on a single sign without a holistic assessment is a deviation from best practice and could lead to delayed or misdiagnoses. Professional reasoning. When faced with a neonate exhibiting subtle changes, the professional decision-making process should begin with a systematic and thorough head-to-toe physical assessment, prioritizing the respiratory system due to its critical importance in neonates. This assessment should be guided by knowledge of normal pediatric anatomy and physiology, including expected vital sign ranges and common variations. The nurse should then correlate objective findings with subjective reports and consider the differential diagnoses. If any findings are concerning or outside expected parameters, further investigation, consultation with a physician, and appropriate interventions should be initiated promptly. This systematic approach ensures patient safety and adherence to professional and regulatory standards. Question 7. Risk assessment procedures indicate a 4-year-old child in a clinic waiting room is actively trying to help the parent tidy up toys, but in doing so is scattering them further and making a mess. The parent expresses mild frustration, stating, "He just wants to be involved, but he makes it worse." Which theoretical framework best explains this child's behavior and guides the nurse's response? Option A. The child is demonstrating a need for direct instruction and scaffolding to learn how to tidy, as emphasized in Vygotsky's zone of proximal development, and the nurse should model the correct behavior. Option B. The child is demonstrating initiative and a desire for autonomy, characteristic of Erickson's stage of initiative vs. guilt, and the nurse should validate this drive while suggesting age-appropriate ways for the child to contribute. Option C. The child is exhibiting egocentrism and a lack of understanding of cause and effect, as described in Piaget's preoperational stage, and the nurse should explain the consequences of their actions. Option D. The child is exploring their sensory motor abilities and learning through direct manipulation of objects, as seen in Piaget's sensoromotor stage, and the nurse should provide more objects for exploration. The correct answer is B. The child is demonstrating initiative and a desire for autonomy, characteristic of Erickson's stage of initiative vs. guilt, and the nurse should validate this drive while suggesting age-appropriate ways for the child to contribute. Explanation. This scenario presents a professional challenge due to the need to accurately interpret a child's behavior within the context of developmental theories, which are foundational to pediatric nursing practice. The nurse must apply theoretical knowledge to a real-world situation to ensure appropriate interventions and communication with the family. Careful judgment is required to differentiate between typical developmental stages and potential areas of concern that might warrant further assessment or referral. The correct approach represents best professional practice because it demonstrates an understanding of Erickson's psychosocial stages, specifically the stage of initiative vs. guilt, which is characteristic of preschool-age children, 3-6 years. A child in this stage is exploring their independence and asserting power and control over their environment. The observed behavior of the child wanting to help with tasks, even if it leads to minor disarray, aligns with this developmental drive. This understanding allows the nurse to validate the child's actions as developmentally appropriate, reassure the parents, and suggest ways to channel this initiative constructively, such as assigning simple, age-appropriate chores. This aligns with the ethical principle of beneficence by promoting the child's healthy development and the principle of non-maleficence by avoiding unnecessary labeling or pathologizing of normal behavior. Furthermore, it upholds the professional standard of providing evidence-based care grounded in established developmental psychology. An incorrect approach that focuses solely on Piaget's sensoromotor stage would be inappropriate because this stage primarily describes infants and very young toddlers, birth to 2 years, and their interaction with the world through senses and motor actions. Applying this theory to a 4-year-old would misinterpret their cognitive abilities and social motivations, leading to an inaccurate assessment of their behavior. This would be an ethical failure, as it deviates from providing competent care based on accurate developmental understanding. Another incorrect approach that interprets the child's actions as purely egocentric, as described in Piaget's preoperational stage, without considering the broader psychosocial context, might lead to an overly negative interpretation. While egocentrism is a characteristic of the preoperational stage, focusing solely on this aspect might overlook the child's emerging desire for autonomy and social interaction, which are key components of Erickson's theory at this age. This could lead to parental frustration and a missed opportunity to foster the child's initiative. Ethically, this would be a failure in providing holistic care that considers all facets of child development. A third incorrect approach that emphasizes the child's need for direct instruction and scaffolding without acknowledging their burgeoning independence, as might be inferred from a strict interpretation of Vygotsky's zone of proximal development, ZPD, could stifle the child's natural drive to explore and experiment. While Vygotsky's theory is crucial for understanding learning, applying it rigidly without considering Erickson's psychosocial needs could lead to interventions that are overly controlling and do not support the child's developing sense of self-efficacy and initiative. This would be a failure in promoting the child's psychosocial well-being. The professional decision-making process for similar situations involves a multi-theoretical approach. The nurse should first observe and gather information about the child's behavior. Then, they should consider how this behavior aligns with various developmental theories, recognizing that different theories offer complementary perspectives. Erickson provides insight into the child's psychosocial needs and stage-specific challenges. Piaget offers understanding of cognitive development, and Vygotsky highlights the role of social interaction and learning. By integrating these perspectives, the nurse can form a comprehensive understanding of the child's behavior, communicate effectively with parents, and implement developmentally appropriate and ethically sound interventions. This integrated approach ensures that care is not only clinically accurate but also supportive of the child's overall growth and well-being. Question 8. Implementation of a new feeding regimen for a 6-month-old infant experiencing rapid weight gain requires the certified pediatric nurse to consider the impact of this growth on the infant's physiological functions. Which stakeholder perspective is most critical for the CPN to prioritize when developing and implementing this feeding plan? Option A. The perceived ease of preparation and cost-effectiveness of various infant formulas for the parents. Option B. The pediatrician's immediate recommendation for a high-calorie formula to accelerate weight gain. Option C. The infant's historical feeding patterns without significant consideration for current developmental stage. Option D. The infant's current growth trajectory, developmental milestones, and the parent's understanding and ability to implement the feeding plan. The correct answer is D. The infant's current growth trajectory, developmental milestones, and the parent's understanding and ability to implement the feeding plan. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified pediatric nurse, CPN, to balance the immediate needs of a rapidly growing infant with the long-term implications of nutritional interventions. The infant's physiological functions are in a constant state of flux, making it difficult to predict responses to dietary changes. The CPN must consider not only the infant's current weight and feeding patterns, but also anticipate how these will evolve and impact organ development, immune function, and overall health trajectory. This necessitates a deep understanding of pediatric growth and development principles, coupled with a commitment to evidence-based practice and patient-centered care, all within the framework of established nursing standards and ethical guidelines. Correct approach analysis. The correct approach, which involves a comprehensive assessment of the infant's current growth parameters, feeding history, and developmental milestones, followed by the development of a tailored feeding plan in collaboration with the parents and healthcare team, represents best professional practice. This aligns with the American Nurses Association ANA Code of Ethics for Nurses, particularly provisions related to patient advocacy, informed decision-making, and the provision of competent care. Specifically, it upholds the principle of respecting patient autonomy by involving parents in the decision-making process and ensuring they understand the rationale behind the feeding plan. Furthermore, it adheres to the standards of pediatric nursing practice, which emphasize individualized care based on a thorough understanding of the child's unique physiological and developmental needs. This approach prioritizes the infant's well-being by ensuring nutritional adequacy for optimal growth and development, while also considering potential risks and benefits of different feeding strategies. Incorrect approaches analysis. One incorrect approach would be to solely focus on increasing the caloric intake without considering the infant's digestive capacity or potential for nutrient imbalances. This fails to acknowledge the impact of growth on the infant's developing gastrointestinal system and could lead to feeding intolerance, malabsorption, or even contribute to unhealthy weight gain patterns, violating the ethical principle of non-maleficence, do no harm. It also neglects the importance of a balanced nutritional profile, which is crucial for supporting all physiological functions during rapid growth. Another incorrect approach would be to recommend a standardized, one-size-fits-all feeding regimen without considering the infant's specific growth trajectory and individual responses. This disregards the principle of individualized care, a cornerstone of pediatric nursing. Growth is not linear, and infants respond differently to various feeding strategies. A standardized approach may not adequately meet the dynamic nutritional demands of a growing infant, potentially hindering optimal development and failing to uphold the CPN's responsibility to provide competent and evidence-based care. A third incorrect approach would be to dismiss parental concerns about the infant's feeding or growth without thorough investigation. This undermines the collaborative nature of care and disrespects the parent's role as primary caregivers. The ANA Code of Ethics emphasizes the nurse's role in facilitating communication and collaboration among the healthcare team, patients, and their families. Ignoring parental input can lead to a breakdown in trust and may result in suboptimal care, as parents often have valuable insights into their child's behavior and feeding patterns. Professional reasoning. Professionals should employ a systematic approach to care that begins with a thorough assessment. This involves gathering subjective data, parental report, and objective data, physical examination, growth charts, feeding logs. Next, they should analyze this data in the context of the infant's age and developmental stage, considering the impact of growth on physiological functions. This analysis should then inform the development of a collaborative plan of care, which is then implemented and continuously evaluated. The decision-making process should be guided by evidence-based practice, ethical principles, and regulatory standards, always prioritizing the child's best interests and involving the family as active partners in care. Question 9. The audit findings indicate a pattern of inconsistent documentation and follow-up regarding developmental assessments in the pediatric clinic. A specific case involves a 2-year-old child whose parents express concern about limited verbalizations and infrequent social interaction, but the initial nurse's note simply states, "Parental concern noted," without further detail or planned action. Which of the following approaches best addresses the risk assessment for this child's growth and development in light of the audit findings? Option A. Reassure the parents that most children develop at their own pace and schedule a routine follow-up appointment in 6 months to reevaluate the concerns. Option B. Focus solely on the child's gross motor skills, as this is typically the most observable area of development at this age, and defer addressing communication and social concerns until a later visit. Option C. Initiate a formal developmental screening using an age-appropriate standardized tool. Gather detailed observations of the child's communication and social play during the visit, and discuss specific strategies with parents for encouraging verbalization and interaction at home. Option D. Document the parental concern and advise the parents to seek a referral to a speech-language pathologist and a child psychologist immediately without conducting any further in-clinic assessment. The correct answer is C. Initiate a formal developmental screening using an age-appropriate standardized tool. Gather detailed observations of the child's communication and social play during the visit, and discuss specific strategies with parents for encouraging verbalization and interaction at home. Explanation. This scenario is professionally challenging because it requires the certified pediatric nurse, CPN, to balance the immediate need for intervention with the nuanced understanding of normal growth and developmental variations in a young child. Overintervention can lead to unnecessary anxiety for the child and family, while underintervention could miss a significant developmental delay. The audit findings highlight a systemic issue in how developmental assessments are being documented and acted upon, necessitating a standardized and evidence-based approach. The correct approach represents best professional practice because it prioritizes a comprehensive, multifaceted assessment that aligns with established pediatric developmental screening guidelines. This approach acknowledges that a single observation may not be definitive, and that a thorough evaluation, considering parental input and standardized tools, is crucial for accurate risk assessment. This aligns with the ethical principle of beneficence, ensuring the child receives appropriate care, and non-maleficence by avoiding unnecessary interventions. Furthermore, it adheres to professional standards of practice for CPNs, which mandate evidence-based assessment and care planning. An incorrect approach that relies solely on parental concern without further objective assessment fails to meet the professional obligation to conduct a thorough evaluation. A parental concern is a valuable indicator. It must be substantiated by objective findings and standardized screening tools to avoid misdiagnosis or overdiagnosis. This approach could lead to missed opportunities for early intervention if the concern is valid but not adequately explored, or unnecessary anxiety and medicalization if the concern is due to normal variation. Another incorrect approach that focuses only on a single developmental milestone, ignoring the broader developmental picture and parental input, is also professionally unacceptable. Development is a holistic process, and a child's progress in one area does not negate potential concerns in others. This narrow focus risks overlooking significant developmental delays that might manifest in different domains. It also disregards the family's perspective, which is a critical component of comprehensive pediatric care. The professional decision-making process for similar situations should involve a systematic approach. 1. Acknowledge and validate parental concerns. 2. Conduct a comprehensive developmental assessment using age-appropriate, standardized screening tools, e.g., Ages and Stages questionnaires, Denver Developmental Screening Test Roman II. 3. Observe the child's behavior and interactions in a naturalistic setting if possible. 4. Gather information about the child's environment and daily routines. 5. Collaborate with parents to understand their observations and concerns. 6. Interpret findings in the context of normal developmental variations and established benchmarks. 7. Develop an individualized care plan, which may include further evaluation, referral to specialists, or reassurance and education for parents, based on the comprehensive assessment. This iterative process ensures that decisions are data-driven, family-centered, and ethically sound. Question 10. Market research demonstrates that parents of children with developmental variations often seek reassurance and clear guidance from their healthcare providers. A certified pediatric nurse is caring for a 3-month-old infant born at 28 weeks gestation who is exhibiting feeding difficulties and a slightly delayed head lag. Simultaneously, the nurse is providing education to the parents of a 4-year-old child with cystic fibrosis who is experiencing increased respiratory infections and expressing frustration with physical therapy exercises. Which of the following approaches best reflects best professional practice in addressing these distinct developmental challenges? Option A. For the infant, conduct a thorough developmental assessment considering corrected gestational age. Explore potential underlying causes for feeding difficulties, and collaborate with the family on feeding strategies. For the older child, validate the child's frustration, explore the barriers to physical therapy engagement, and work collaboratively with the family and the child to adapt the therapy plan to improve adherence and outcomes. Option B. For the infant, focus on chronological age milestones and recommend standard infant feeding techniques, assuming the prematurity is a minor factor. For the older child, suggest that the child's frustration is a normal reaction to illness and that the parents should focus on managing the chronic condition without significant adjustments to the therapy regimen. Option C. For the infant, immediately refer to a specialist for all feeding concerns and developmental delays, and for the older child, provide generic information on managing cystic fibrosis, and encourage the parents to seek external support groups for behavioral issues related to chronic illness. Option D. For the infant, acknowledge that feeding difficulties and head lag are common in premature infants and will likely resolve with time, while for the older child, emphasize the importance of adherence to the treatment plan for cystic fibrosis, suggesting the parents enforce compliance. The correct answer is D. For the infant, acknowledge that feeding difficulties and head lag are common in premature infants and will likely resolve with time, while for the older child, emphasize the importance of adherence to the treatment plan for cystic fibrosis, suggesting the parents enforce compliance. Explanation. This scenario is professionally challenging because it requires the certified pediatric nurse, CPN, to navigate the complex interplay of developmental variations, parental concerns, and evidence-based practice within the specific regulatory framework governing pediatric nursing in the United States. The prematurity of the infant and the chronic illness of the older child introduce unique developmental trajectories that necessitate individualized care plans and communication strategies. The CPN must balance the need for timely intervention with the potential for overmedicalization or misinterpretation of normal developmental variations, all while adhering to professional standards of care and ethical principles. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized assessment that considers the child's specific gestational age, developmental milestones, and the impact of their chronic illness. This approach aligns with the American Nurses Association (ANA) Code of Ethics, which emphasizes the nurse's responsibility to advocate for patients and provide care that respects their dignity and individuality. Furthermore, it adheres to the standards of practice for certified pediatric nurses, which mandate the use of evidence-based interventions and ongoing evaluation of patient outcomes. Effective communication with the parents, acknowledging their concerns while providing accurate, age-appropriate information, is also a cornerstone of ethical and effective pediatric nursing care, fostering trust and collaboration. An incorrect approach that focuses solely on the chronological age of the infant without accounting for prematurity would be a failure to adhere to the principle of individualized care. This could lead to inappropriate expectations and interventions, potentially causing undue stress to the infant and family. Ethically, it violates the duty to provide competent care tailored to the patient's unique needs. Another incorrect approach that dismisses parental concerns about the older child's development without a thorough assessment would be a violation of the ethical principle of respect for persons and the professional obligation to listen to and address patient and family concerns. This could lead to delayed diagnosis of potential developmental delays or exacerbation of chronic conditions, impacting the child's long-term well-being. It also fails to meet the standards of care that require thorough assessment and collaboration with families. A third incorrect approach that relies on outdated or unsubstantiated anecdotal evidence rather than current research and best practices would be a failure to uphold the professional standard of evidence-based practice. This could result in suboptimal care and potentially harmful interventions, contravening the CPN's responsibility to provide the highest quality of care as outlined by professional nursing organizations and regulatory bodies. The professional decision-making process for similar situations should involve a systematic approach. 1. Thoroughly assess the child's current status, considering all contributing factors: gestational age, chronic illness, environmental influences. 2. Engage in open and empathetic communication with the parents, actively listening to their concerns and providing clear evidence-based information. 3. Consult relevant professional guidelines, research, and potentially interdisciplinary team members to inform care decisions. 4. Develop and implement an individualized care plan that addresses the child's unique needs and developmental trajectory. 5. Continuously evaluate the effectiveness of interventions and adjust the plan as necessary, always prioritizing the child's safety and well-being. Question 11. Governance review demonstrates a pediatric unit has experienced an increase in admissions for children presenting with prolonged fever, conjunctivitis, rash, and changes in extremities. A recent case involved a 3-year-old who presented with a 5-day history of fever, bilateral non-exudative conjunctivitis, a diffuse erythematous rash, and peeling of the skin on the fingertips. The nurse caring for this child, recognizing the potential for a serious acquired heart condition, needs to determine the most appropriate immediate action to ensure optimal patient outcomes. Option A. Document the symptoms thoroughly and wait for the results of routine blood work, such as a complete blood count and basic metabolic panel, before discussing the case with the provider. Option B. Advise the parents that these symptoms are likely due to a common childhood virus and recommend supportive care at home. Option C. Monitor the child's vital signs and administer antipyretics as needed, awaiting further development of symptoms before contacting the provider. Option D. Immediately notify the pediatric provider of the child's clinical presentation and advocate for further diagnostic evaluation, including an echocardiogram and consideration for intravenous immunoglobulin therapy. The correct answer is D. Immediately notify the pediatric provider of the child's clinical presentation and advocate for further diagnostic evaluation, including an echocardiogram and consideration for intravenous immunoglobulin therapy. Explanation. Scenario analysis. This scenario presents a common yet complex challenge in pediatric nursing: Managing a child with a suspected acquired heart condition, specifically Kawasaki disease, where timely and accurate diagnosis is paramount to prevent severe sequelae. The challenge lies in the subtle and sometimes nonspecific initial presentation, the need for rapid escalation of care, and the potential for significant long-term cardiac complications if not managed appropriately. The nurse must synthesize evolving clinical data, recognize potential red flags, and advocate effectively for the child's needs within a multidisciplinary team. Correct approach analysis. The correct approach involves recognizing the constellation of symptoms suggestive of Kawasaki disease, including fever, conjunctivitis, rash, and extremity changes, and initiating prompt communication with the pediatric provider for further evaluation and management. This aligns with the American Nurses Association ANA Code of Ethics for Nurses, which emphasizes the nurse's responsibility to advocate for the patient and ensure continuity of care. Furthermore, adherence to established clinical practice guidelines for Kawasaki disease, such as those developed by the American Academy of Pediatrics (OP) or the American Heart Association (AHA), is crucial. These guidelines provide evidence-based recommendations for diagnosis, treatment, and follow-up, aiming to minimize the risk of coronary artery aneurysms. Prompt notification of the provider ensures timely diagnostic workup, including echocardiography and initiation of intravenous immunoglobulin IVIG therapy, which is most effective when administered within the first 10 days of illness. Incorrect approaches analysis. One incorrect approach is to attribute the child's symptoms solely to a common viral illness and delay further investigation. This fails to meet the standard of care for pediatric nursing, as it overlooks potentially serious conditions. Ethically, this constitutes a breach of the nurse's duty to provide competent care and advocate for the patient's well-being. Regulatory frameworks, such as state nurse practice acts, mandate that nurses practice within their scope and possess the knowledge and skills to identify and respond to changes in patient condition. Another incorrect approach is to wait for definitive laboratory results before escalating care. While laboratory tests can be supportive, the diagnosis of Kawasaki disease is primarily clinical. Delaying communication with the provider based on the absence of specific lab findings would contraindicate the urgency required for effective treatment and could lead to irreversible cardiac damage, violating professional standards and potentially leading to malpractice claims. A third incorrect approach is to independently initiate treatment without a provider's order. This exceeds the nurse's scope of practice and bypasses the essential collaborative decision-making process required for managing complex pediatric conditions, violating regulatory mandates regarding the nurse's role and responsibilities. Professional reasoning. Professionals should employ a systematic decision-making framework that begins with a thorough assessment of the child's signs and symptoms, comparing them against established criteria for suspected Kawasaki disease. This should be followed by critical thinking to identify any deviations from normal and potential red flags. The next step involves consulting relevant clinical practice guidelines and evidence-based resources to inform the assessment and potential differential diagnoses. Crucially, effective communication and collaboration with the interdisciplinary team, particularly the pediatric provider, are essential for timely diagnosis and management. This includes clear, concise reporting of assessment findings and a proactive approach to advocating for the child's needs. Continuous learning and staying abreast of current recommendations for acquired heart conditions in children are also vital components of professional practice. Question 12. Investigation of a 5-year-old child diagnosed with asthma who has experienced increased nocturnal awakenings and daytime fatigue over the past 2 weeks requires a systematic approach to optimize their management plan. The child's parents report adherence to prescribed daily inhaled corticosteroids and a rescue inhaler, but express concern about the child's declining activity levels and frequent requests for naps. The nurse is considering several strategies to address these changes. Option A. Recommend that the child rest more and limit strenuous physical activities until their symptoms improve, assuming this is a temporary exacerbation that will resolve on its own with rest. Option B. Conduct a comprehensive assessment of the child's asthma control, including triggers, adherence to medication, inhaler technique, and any potential psychosocial stressors impacting the child or family. Collaborate with the family and the pediatric pulmonologist to adjust the treatment plan based on findings, potentially incorporating a long-acting bronchodilator or considering a short course of oral corticosteroids if indicated. Option C. Advise the parents to increase the frequency of the child's rescue inhaler use as needed, as this is the primary intervention for acute asthma symptoms, and monitor for any improvement in the child's energy levels. Option D. Focus solely on ensuring the child is taking their daily inhaled corticosteroid correctly, and suggest the parents consult a child psychologist to address the child's fatigue, as it may be behavioral. The correct answer is B. Conduct a comprehensive assessment of the child's asthma control, including triggers, adherence to medication, inhaler technique, and any potential psychosocial stressors impacting the child or family. Collaborate with the family and the pediatric pulmonologist to adjust the treatment plan based on findings, potentially incorporating a long-acting bronchodilator or considering a short course of oral corticosteroids if indicated. Explanation. This scenario presents a common challenge in pediatric nursing, managing a child with a chronic condition and ensuring continuity of care across different settings. The professional challenge lies in balancing the immediate needs of the child and family with the long-term management plan, while also navigating the complexities of interdisciplinary communication and resource utilization. Careful judgment is required to ensure the child receives appropriate, safe, and effective care that supports their developmental needs and family's well-being. The correct approach represents best professional practice because it prioritizes a comprehensive, family-centered assessment and collaborative care planning. This aligns with the ethical principles of beneficence and non-maleficence, ensuring the child's best interests are met. It also adheres to professional nursing standards that emphasize patient advocacy, interdisciplinary teamwork, and evidence-based practice. Specifically, it reflects the guidelines for pediatric care that advocate for early identification of potential issues, proactive management strategies, and empowering families as partners in care. This approach ensures that all relevant stakeholders are involved, leading to a more holistic and effective care plan. An incorrect approach that focuses solely on symptom management without addressing underlying psychosocial factors fails to meet the comprehensive needs of a child with a chronic condition. This could lead to suboptimal outcomes and potentially exacerbate the condition due to unaddressed stressors. Ethically, this approach could be seen as a failure of beneficence by not fully addressing the child's well-being. Another incorrect approach that relies on a single discipline's perspective without adequate consultation overlooks the multifaceted nature of pediatric chronic conditions. This can result in fragmented care, miscommunication, and potentially conflicting treatment recommendations, which is a failure of professional collaboration and can compromise patient safety. Regulatory frameworks for pediatric nursing emphasize interdisciplinary communication and coordinated care. A third incorrect approach that delays intervention due to perceived resource limitations, without exploring alternative solutions or escalating concerns, could lead to a decline in the child's condition. This represents a failure in professional responsibility and advocacy, potentially violating the principle of timely and appropriate care. Professionals should utilize a decision-making framework that begins with a thorough assessment of the child and family's needs, considering physical, psychosocial, developmental, and environmental factors. This should be followed by collaborative goal setting with the family and the interdisciplinary team. Evidence-based practice should guide the development of the care plan, and ongoing evaluation and adjustment are crucial. Professionals must advocate for necessary resources and communicate effectively to ensure coordinated and comprehensive care. Question 13. What factors determine a pediatric nurse's immediate course of action when encountering a child exhibiting signs and symptoms suggestive of physical abuse, considering the regulatory framework for mandatory reporting in the United States? Option A. The nurse's personal belief about the likelihood of abuse, independent of any formal reporting guidelines. Option B. The nurse's professional judgment based on established protocols for mandatory reporting of suspected child abuse or neglect. Option C. The nurse's assessment of whether the child's injuries are severe enough to warrant immediate hospitalization before any reporting occurs. Option D. The nurse's desire to avoid causing distress to the child's family by delaying the reporting process. The correct answer is B. The nurse's professional judgment based on established protocols for mandatory reporting of suspected child abuse or neglect. Explanation. This scenario is professionally challenging because it requires the pediatric nurse to balance the immediate needs of a child with the legal and ethical obligations to report suspected abuse or neglect. The nurse must act as a patient advocate while adhering to mandatory reporting laws, which can create internal conflict and require careful judgment. The correct approach represents best professional practice because it prioritizes the child's safety and well-being by adhering to the legal mandate of reporting suspected child abuse or neglect. In the United States, the Child Abuse Prevention and Treatment Act, CAPTA, and state-specific child welfare laws establish pediatric nurses as mandatory reporters. Failure to report suspected abuse or neglect can result in legal penalties, professional sanctions, and most importantly, a failure to protect a vulnerable child from further harm. This approach aligns with the ethical principles of beneficence, acting in the child's best interest, and non-maleficence, avoiding harm. An incorrect approach that involves delaying reporting to gather more definitive proof before contacting authorities is professionally unacceptable. This delay can be interpreted as a failure to meet the mandatory reporting requirements, as suspicion alone is often sufficient grounds for reporting. The regulatory framework generally does not require absolute certainty. Rather, reasonable suspicion is the threshold for reporting. Such a delay could allow abuse to continue, causing further harm to the child, and could lead to legal repercussions for the nurse and the healthcare facility. Another incorrect approach, such as discussing the suspected abuse with the parents before reporting, is also professionally unacceptable. This action violates the confidentiality principles that apply to patient information, but more critically, it can alert potential abusers, leading to the destruction of evidence, intimidation of the child, or further harm. It also undermines the investigative process and the nurse's role as a mandated reporter. A further incorrect approach, such as relying solely on the physician to make the reporting decision, is a failure to understand the nurse's independent responsibility as a mandated reporter. While collaboration with the physician is essential in a child's care, the legal obligation to report suspected abuse or neglect rests with the nurse individually. Delegating this responsibility is a breach of professional duty and regulatory compliance. The professional decision-making process for similar situations should involve a clear understanding of mandatory reporting laws, a commitment to the child's safety, and a systematic approach. This includes 1. Recognizing signs and symptoms suggestive of abuse or neglect. 2. Documenting observations thoroughly and objectively. 3. Consulting with a supervisor or colleague if unsure about the threshold for reporting. 4. Promptly making the report to the appropriate Child Protective Services agency or law enforcement, as per jurisdictional guidelines. 5. Cooperating fully with the subsequent investigation. Question 14. When evaluating a 2-year-old child presenting with subtle delays in expressive language and fine motor skills, and the parents express mild concerns about their child's development, which of the following referral processes best aligns with best professional practice for a certified pediatric nurse? Option A. Directly refer the child to a speech-language pathologist and an occupational therapist without consulting the child's primary care provider, assuming these specialists can manage the referral process. Option B. Conduct a comprehensive developmental screening, document findings, and initiate a referral to early intervention services in consultation with the child's primary care provider. Option C. Advise the parents to monitor the child's development closely and provide them with general resources on child development, deferring any formal referral at this time. Option D. Reassure the parents that most children experience developmental variations and suggest they wait until the child's next scheduled well-child visit to discuss any ongoing concerns. The correct answer is B. Conduct a comprehensive developmental screening, document findings, and initiate a referral to early intervention services in consultation with the child's primary care provider. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a pediatric nurse to identify subtle signs of developmental delay in a young child and initiate the appropriate referral pathway. The challenge lies in distinguishing between normal developmental variations and potential concerns that warrant further evaluation, while also navigating the complexities of the healthcare system and ensuring timely access to specialized services for the child. Balancing the need for prompt intervention with avoiding unnecessary anxiety for the family is also a critical consideration. Correct approach analysis. The correct approach involves a comprehensive assessment of the child's developmental milestones across various domains: gross motor, fine motor, language, social-emotional, and comparing these observations against established developmental norms. When concerns arise, the best professional practice is to consult with the child's primary care provider and initiate a referral to appropriate early intervention services or specialists as indicated by the assessment findings and established protocols. This aligns with the ethical obligation to advocate for the child's well-being and ensure access to necessary care, as well as regulatory guidelines that mandate timely identification and management of developmental concerns. The Certified Pediatric Nurse (CPN) certification emphasizes a strong understanding of developmental assessment and referral processes, underscoring the importance of this systematic approach. Incorrect approaches analysis. One incorrect approach would be to dismiss parental concerns without a thorough assessment, assuming the child will catch up on their own. This fails to meet the professional standard of care and could lead to delayed diagnosis and intervention, potentially impacting the child's long-term developmental trajectory. Ethically, this approach neglects the nurse's duty to assess and advocate for the child. Another incorrect approach would be to bypass the primary care provider and directly refer to a specialist without proper consultation or documentation. While well-intentioned, this can disrupt the established care coordination process, potentially leading to fragmented care, duplication of services, or a lack of comprehensive understanding of the child's overall health status. Regulatory frameworks often emphasize a collaborative approach to care, with the primary care provider serving as a central point of contact. A third incorrect approach would be to provide the parents with extensive educational materials on developmental delays and suggest they monitor the child independently without initiating a formal referral process. While education is important, it is not a substitute for professional assessment and the initiation of a referral when developmental concerns are present. This approach places an undue burden on the parents and delays access to professional evaluation and support services. Professional reasoning. When faced with potential developmental concerns, a pediatric nurse should utilize a structured decision-making process. This begins with active listening to parental concerns and conducting a thorough, age-appropriate developmental assessment. The nurse should then critically analyze the findings, comparing them to established developmental milestones. If concerns are identified, the next step is to consult with the child's primary care provider to discuss the findings and collaboratively determine the most appropriate course of action, which typically involves initiating a referral to early intervention services or relevant specialists. This collaborative and systematic approach ensures that the child receives timely and appropriate evaluation and support, adhering to both ethical principles and regulatory requirements for pediatric care. Question 15. Stakeholder feedback indicates that while a child's ages and stages questionnaires, 3rd edition, Ask 3, results suggest typical development in most domains, the child's performance on the Denver Developmental Screening Test Roman 2, Denver Roman 2, reveals delays in fine motor skills. The parents express significant concern about their child's fine motor abilities. As a certified pediatric nurse, what is the most appropriate next step? Option A. Acknowledge the discrepancy, discuss the findings with the parents, and recommend a comprehensive developmental evaluation by a multidisciplinary team to further investigate the fine motor delays. Option B. Focus solely on the Denver Roman 2 findings, dismissing the ASQ3 as less accurate, and immediately refer the child for occupational therapy without further assessment. Option C. Advise the parents that since the ASQ3 indicates typical development, their concerns are likely unfounded and no further action is needed at this time. Option D. Reassure the parents that the ASQ3 is a reliable tool and that the Denver Roman 2 results may be an anomaly, advising them to monitor the situation. The correct answer is D. Reassure the parents that the ASQ3 is a reliable tool and that the Denver Roman 2 results may be an anomaly, advising them to monitor the situation. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified pediatric nurse, CPN, to navigate conflicting information from different assessment tools and stakeholder perspectives. The Ask 3, a parent-completed questionnaire, provides valuable insights into a child's development from the caregiver's viewpoint, while the Denver Roman 2, administered by a trained professional, offers a standardized, observational assessment. Discrepancies between these tools, coupled with parental concern, necessitate a nuanced approach that prioritizes the child's well-being and adheres to professional standards of care. The CPN must synthesize information from multiple sources, consider the limitations of each tool, and communicate effectively with parents and other healthcare providers. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized assessment that integrates multiple data points. The Ask-3, while a valuable screening tool, is a parent report and can be influenced by parental perception or anxiety. The Denver Roman 2 provides a direct, observational assessment of developmental milestones. When there is a discrepancy, further investigation is warranted. This approach aligns with the ethical principle of beneficence, ensuring the child receives appropriate evaluation and intervention if needed. It also reflects the professional responsibility of a CPN to utilize a variety of assessment tools and to follow up on concerning findings, rather than dismissing them. This aligns with the general principles of pediatric nursing practice, which emphasize thoroughness and patient-centered care. Incorrect approaches analysis. One incorrect approach involves solely relying on the ASQ-3 results and reassuring the parents without further investigation, despite the Denver Roman 2 indicating potential concerns. This fails to acknowledge the limitations of a parent report tool and dismisses objective findings from a standardized assessment. Ethically, this could be considered a failure of due diligence and potentially violate the principle of non-maleficence by delaying necessary intervention. Another incorrect approach is to disregard the ASQ-3 entirely and focus only on the Denver Roman 2, dismissing parental concerns. This approach undervalues the caregiver's crucial role in observing the child's daily functioning and can erode parental trust. It also fails to consider that the ASQ-3 might highlight subtle developmental nuances not captured by the Denver Roman 2 in a single administration. A third incorrect approach is to immediately recommend specialized therapy based solely on the discrepancy, without a more thorough clinical evaluation or consultation. While prompt intervention is important, an immediate referral without a comprehensive understanding of the child's overall development and the specific nature of the discrepancy could lead to unnecessary interventions or misdiagnosis. This could be seen as a failure to practice within the scope of the CPN's expertise without further assessment. Professional reasoning. Professionals should employ a decision-making framework that involves 1. Information gathering. Collect data from all available sources, including parent reports, Ask-3, direct assessments, Denver Roman 2, and medical history. 2. Analysis. Compare and contrast findings from different tools, identifying areas of agreement and disagreement. Consider the strengths and limitations of each assessment method. 3. Clinical judgment. Synthesize the gathered information with professional knowledge and experience to form a clinical impression. 4. Communication. Discuss findings and concerns openly and empathetically with parents, explaining the rationale for further steps. 5. Action planning. Develop a plan that may include further assessment, consultation with specialists, or appropriate interventions, always prioritizing the child's best interests and adhering to established pediatric nursing standards. Question 16. Operational review demonstrates that a 6-month-old infant, exclusively breastfed, is presenting with a plateau in weight gain over the past 2 months, despite appearing otherwise healthy and meeting developmental milestones. The parents express strong reservations about introducing solid foods, citing concerns about allergies and potential digestive upset, and prefer to continue exclusive breastfeeding. The pediatric nurse is tasked with developing a nutritional intervention plan. Which of the following approaches best addresses this situation? Option A. Advise the parents to supplement breastfeeding with commercially available infant formula to increase caloric intake, without discussing the introduction of solid foods. Option B. Recommend that the parents increase the frequency of breastfeeding sessions and ensure the mother is consuming a high-calorie diet to indirectly improve the infant's nutritional intake. Option C. Initiate a comprehensive assessment of the infant's current breastfeeding intake, growth trajectory, and developmental status, followed by a discussion with the parents about the benefits of age-appropriate complementary feeding, addressing their specific concerns with evidence-based information, and collaboratively developing a gradual introduction plan for nutrient-dense solids. Option D. Reassure the parents that exclusive breastfeeding is sufficient for infants up to 1 year of age, and continue to monitor the infant's weight without further intervention, as occasional weight plateaus are normal. The correct answer is C. Initiate a comprehensive assessment of the infant's current breastfeeding intake, growth trajectory, and developmental status, followed by a discussion with the parents about the benefits of age-appropriate complementary feeding, addressing their specific concerns with evidence-based information, and collaboratively developing a gradual introduction plan for nutrient-dense solids. Explanation. This scenario presents a common challenge in pediatric nursing, balancing parental preferences with evidence-based nutritional recommendations for an infant with specific medical needs. The professional challenge lies in respecting parental autonomy while ensuring the child's optimal health and development, adhering to established pediatric nutritional guidelines and best practices. Careful judgment is required to navigate potential conflicts and provide effective, individualized care. The correct approach prioritizes a comprehensive assessment of the infant's nutritional status, growth patterns, and any underlying medical conditions that might influence dietary needs. It involves open communication with the parents, educating them about the rationale behind recommended interventions, and collaboratively developing a feeding plan that addresses the infant's specific requirements. This approach aligns with the ethical principles of beneficence, acting in the child's best interest, and non-maleficence, avoiding harm, as well as professional nursing standards that mandate evidence-based practice and patient-centered care. It also respects parental rights to participate in decision-making while ensuring the child's safety and well-being are paramount. An incorrect approach that dismisses parental concerns or imposes a rigid feeding plan without thorough assessment and discussion fails to uphold the principle of shared decision-making and can erode trust between the healthcare team and the family. This could lead to non-adherence to the feeding plan and potentially negative health outcomes for the infant. Another incorrect approach might involve solely relying on parental anecdotal evidence or unverified online information, disregarding established pediatric nutritional guidelines and the infant's clinical presentation. This poses a significant risk of inadequate nutrition, growth faltering, or exacerbation of existing medical conditions, violating the nurse's duty of care. A third incorrect approach could be to provide generic nutritional advice without tailoring it to the infant's specific age, developmental stage, and medical history, failing to meet the individualized needs of the child. The professional decision-making process for similar situations should involve a systematic approach. First, conduct a thorough assessment of the infant's nutritional status and any contributing factors. Second, engage in active listening and empathetic communication with the parents to understand their concerns and beliefs. Third, provide clear, evidence-based information regarding recommended nutritional interventions, explaining the rationale and potential benefits and risks. Fourth, collaboratively develop a personalized feeding plan, incorporating parental input where appropriate and safe. Finally, establish a plan for ongoing monitoring and evaluation of the infant's progress, and adjust the plan as needed. Question 17. Quality control measures reveal that a pediatric nurse is consistently obtaining incomplete respiratory assessments on toddlers. The nurse needs to adapt their approach to gather more accurate and comprehensive data while minimizing the child's anxiety. Which of the following techniques would best address this challenge? Option A. Incorporate play-based activities to observe breathing patterns and listen to lung sounds. Option B. Proceed with the assessment without significant parental involvement. Option C. Rely solely on verbal questioning to understand the child's respiratory symptoms. Option D. Conduct a standard adult respiratory assessment, expecting the child to cooperate. The correct answer is A. Incorporate play-based activities to observe breathing patterns and listen to lung sounds. Explanation. Scenario analysis. This scenario presents a common challenge in pediatric nursing, adapting assessment techniques to a child's developmental stage while ensuring accurate data collection. The difficulty lies in balancing the need for objective findings with the child's emotional state and cognitive abilities, which can significantly impact their cooperation and the reliability of the assessment. A nurse must be adept at using age-appropriate communication and physical examination methods to gain trust and elicit valid information without causing undue distress. Correct approach analysis. Utilizing a play-based approach to assess a toddler's respiratory status is the best professional practice. This aligns with the developmental stage of toddlers, who often communicate and express themselves through play. By incorporating toys or simple games, the nurse can observe the child's breathing patterns, listen to lung sounds, perhaps by pretending to listen to a teddy bear's breaths, and assess for signs of distress in a less threatening manner. This method respects the child's need for familiarity and control, fostering a more cooperative and accurate assessment. This approach is supported by pediatric nursing standards of practice, which emphasize family-centered care and developmentally appropriate interventions. Incorrect approach is analysis, attempting to perform a standard adult respiratory assessment without modification, such as immediately placing a stethoscope on the child's chest without introduction or explanation, is professionally unacceptable. This approach disregards the child's developmental stage and can lead to fear, resistance, and inaccurate findings due to the child's distress and movement. It fails to meet the ethical obligation to minimize harm and promote comfort. Using only verbal questioning to assess respiratory status in a toddler is also professionally unacceptable. Toddlers have limited verbal abilities and may not be able to articulate their symptoms effectively. Relying solely on verbal input ignores crucial nonverbal cues and objective physical findings, leading to an incomplete and potentially misleading assessment. This violates the principle of thoroughness in assessment. Ignoring parental input and proceeding with the assessment independently is professionally unacceptable. Parents are valuable sources of information regarding their child's baseline behavior, recent changes, and potential concerns. Excluding them from the assessment process not only misses critical data, but also undermines the collaborative nature of pediatric care and can erode parental trust. This contravenes the principles of family-centered care and effective communication. Professional reasoning. When faced with assessing a pediatric patient, the professional decision-making process should begin with identifying the child's developmental stage. This informs the selection of communication strategies and assessment techniques. The nurse should then consider the presenting problem and the specific data needed, prioritizing a non-threatening, age-appropriate approach that incorporates the child's comfort and the family's involvement is paramount. This involves observing the child in their environment, using play and distraction, and employing gentle, systematic examination methods. Continuous reassessment and adaptation of techniques based on the child's response are also critical components of effective pediatric assessment. Question 18. The assessment process reveals that a 15-month-old child has scored below the expected developmental milestone on a standardized screening tool for gross motor skills. The child's parents report no specific concerns about their child's mobility, and the nurse's direct observation during the examination shows the child is able to stand independently and attempts to cruise along furniture. Which of the following interpretations of this screening result best reflects best professional practice for a certified pediatric nurse? Option A. Immediately refer the child to a pediatric physical therapist for a comprehensive evaluation due to the abnormal screening result. Option B. Dismiss the screening result as a potential anomaly, as the child is able to stand and cruise and no parental concerns have been raised. Option C. Acknowledge the screening result but focus on the observed clinical abilities and parental report, considering the screening tool's limitations and the child's overall presentation before determining the need for further action. Option D. Inform the parents that their child is developmentally delayed based solely on the screening tool's score and advise them to seek immediate specialist consultation. The correct answer is A. Immediately refer the child to a pediatric physical therapist for a comprehensive evaluation due to the abnormal screening result. Explanation. The assessment process reveals a common yet challenging scenario in pediatric nursing, interpreting screening results that fall outside typical ranges. This situation is professionally challenging because screening tools are designed to identify potential issues, not to provide definitive diagnoses. The nurse must exercise careful judgment to avoid overinterpreting results, which can lead to unnecessary parental anxiety and potentially invasive or costly follow-up procedures, or underinterpreting them, which could delay crucial interventions. The certified pediatric nurse, CPN, must navigate this by understanding the limitations of screening, the nuances of pediatric development, and the specific regulatory guidelines for reporting and follow-up. The correct approach represents best professional practice by prioritizing a comprehensive assessment and appropriate communication. This aligns with the ethical principle of beneficence, acting in the child's best interest, and non-maleficence, avoiding harm. Regulatory frameworks for pediatric nursing, such as those governed by the Pediatric Nursing Certification Board, PNCB, and relevant state nursing practice acts, emphasize the importance of accurate assessment, evidence-based practice, and clear communication with families. A CPN is expected to integrate screening data with clinical observations, developmental history, and family context before recommending further action. This approach ensures that interventions are justified, timely, and tailored to the individual child's needs, thereby upholding professional standards and patient safety. An incorrect approach that involves immediately escalating the screening result for further specialist evaluation without a thorough clinical correlation fails to adhere to the principle of judicious resource utilization and can cause undue stress. Ethically, this could be seen as a failure to adequately assess the situation before involving other providers. Regulatory failure here lies in not following a systematic, evidence-based approach to interpreting screening data, potentially violating standards of care that require a holistic assessment. Another incorrect approach, that of dismissing the screening result as insignificant without further consideration, poses a significant risk of harm. This could lead to a delay in diagnosis and treatment for a condition that the screening tool was designed to detect. This directly violates the principle of non-maleficence and could be considered a breach of the standard of care, potentially leading to regulatory scrutiny for negligence. A third incorrect approach, which involves sharing the screening result with the family without providing context or explaining the next steps, is a failure in communication and patient education. This can lead to confusion, anxiety, and a lack of trust in the healthcare provider. Professional ethical guidelines and regulatory requirements mandate clear, understandable communication with families about their child's health status and the rationale behind any recommended actions. The professional decision-making process for similar situations should involve a systematic approach. 1. Review the screening tool's purpose, sensitivity, and specificity. 2. Correlate the screening result with the child's age, developmental stage, and any observed clinical signs or symptoms. 3. Consider the child's medical history and family history. 4. Consult with colleagues or supervisors if uncertainty exists. 5. Communicate findings and recommendations clearly and empathetically to the family, explaining the rationale and next steps. 6. Document the entire process thoroughly. Question 19. Benchmark analysis indicates that a certified pediatric nurse is caring for an infant presenting with tachypnea, poor feeding, and a new onset of cyanosis. The nurse suspects a congenital heart defect. Which of the following nursing approaches best aligns with the principles of risk assessment and evidence-based practice for this situation? Option A. Initiate oxygen therapy and closely monitor vital signs, waiting physician orders for further diagnostic workup. Option B. Perform a comprehensive physical assessment, including auscultation for murmurs and palpation for pulses, to gather data that can help differentiate between common types of congenital heart defects and guide immediate nursing interventions. Option C. Administer a prescribed diuretic to manage potential fluid overload, assuming the cyanosis is secondary to heart failure. Option D. Focus on providing comfort measures and ensuring adequate hydration, as the infant's condition is likely to stabilize with supportive care alone. The correct answer is A. Initiate oxygen therapy and closely monitor vital signs, awaiting physician orders for further diagnostic workup. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified pediatric nurse, CPN, to differentiate between various congenital heart defects, CHD, and apply appropriate, individualized nursing care based on the specific pathophysiology. The complexity arises from the potential for subtle differences in presentation, the need for rapid assessment, and the critical impact of nursing interventions on patient outcomes and family coping. Accurate identification and management are paramount, as errors can lead to significant morbidity or mortality. Correct approach analysis. The correct approach involves a systematic assessment that prioritizes identifying the specific type of CHD and its immediate physiological impact. This aligns with the CPN scope of practice, emphasizing evidence-based care and patient safety. Best professional practice dictates that nursing care plans for CHDs are tailored to the defect's hemodynamics, such as the presence of cyanosis, the degree of shunting, and the potential for heart failure. This approach ensures that interventions directly address the underlying problem and its consequences, such as managing oxygenation, fluid balance, and providing comfort. Adherence to established pediatric nursing standards of care, as outlined by professional organizations and regulatory bodies governing nursing practice in the U.S., is essential. This includes accurate documentation, timely communication with the healthcare team, and patient/family education, all of which are foundational to safe and effective pediatric nursing. Incorrect approach is analysis. One incorrect approach involves focusing solely on general signs of distress without attempting to pinpoint the specific CHD. This is a regulatory and ethical failure because it deviates from the standard of care that mandates a more precise diagnosis-driven approach. It risks delayed or inappropriate interventions, potentially leading to adverse patient outcomes, which violates the CPN's duty to provide competent and individualized care. Another incorrect approach is to assume a common CHD without a thorough assessment, leading to the application of a standardized, nonspecific care plan. This is a failure in professional judgment and adherence to best practices. It overlooks the unique presentation of each child and the specific needs dictated by their particular defect, potentially missing critical signs or implementing ineffective treatments. This can be considered a breach of the nursing standard of care, which requires individualized care planning. A third incorrect approach might be to defer all diagnostic and management decisions to the physician, providing only basic supportive care. While collaboration is crucial, the CPN has a distinct role in assessment, monitoring, and implementing specific nursing interventions related to CHDs. Failing to actively participate in the diagnostic process and care planning beyond basic support represents a failure to utilize the full scope of their expertise and can be seen as a dereliction of professional responsibility to advocate for and provide comprehensive care to the pediatric patient. Professional reasoning. Professionals should employ a systematic approach to assessing pediatric patients with suspected or diagnosed CHDs. This involves 1. Rapid assessment of vital signs and oxygenation status. 2. Focused physical assessment for signs indicative of specific CHDs, e.g., murmurs, cyanosis, edema. 3. Review of diagnostic data, echocardiogram, chest X-ray. 4. Development of an individualized nursing care plan based on the identified defect and its physiological consequences. 5. Continuous monitoring and evaluation of the patient's response to interventions. 6. Effective communication with the interdisciplinary team and family. This structured decision-making process ensures that care is evidence-based, patient-centered, and aligned with regulatory requirements for safe and competent nursing practice. Question 20. The control framework reveals a situation where a parent expresses significant hesitation and concern regarding the prescribed medication for their infant's diagnosed gastroesophageal reflux disease, GERD, citing anecdotal evidence from online forums about potential long-term side effects. The infant is experiencing frequent spitting up, discomfort during feeding, and poor weight gain, consistent with moderate GERD. The nurse is tasked with administering the medication and educating the parent on its importance. Option A. Immediately document the parent's refusal and inform the physician that the parent is not complying with the treatment plan, suggesting a referral to social work for potential noncompliance issues. Option B. Gently explain the physician's rationale for the medication. Provide evidence-based information on the benefits and known risks of the prescribed GERD medication, and offer to facilitate a discussion between the parent and the physician to address their specific concerns. Option C. Agree with the parent's concerns, reassure them that the medication is likely unnecessary, and suggest they try home remedies instead, deferring the decision to the parent's judgment. Option D. Acknowledge the parent's concerns but proceed with administering the medication as prescribed, stating that the physician's orders must be followed without question. Correct answer is B. Gently explain the physician's rationale for the medication. Provide evidence-based information on the benefits and known risks of the prescribed GERD medication, and offer to facilitate a discussion between the parent and the physician to address their specific concerns. Explanation. This scenario presents a common ethical dilemma in pediatric nursing, balancing parental autonomy with the child's best interest and adherence to established clinical guidelines. Challenge lies in navigating parental concerns, which may stem from misinformation or personal beliefs, while ensuring the child receives appropriate and evidence-based care for a potentially distressing condition like GERD. The nurse must act as an advocate for the child, utilizing their professional knowledge and communication skills to educate and guide the parents. The correct approach emphasizes open communication, education, and collaboration with the healthcare team. This aligns with ethical principles of beneficence, acting in the child's best interest, non-maleficence, avoiding harm, and respect for autonomy, acknowledging parental rights while prioritizing the child's well-being. It also adheres to professional nursing standards that mandate evidence-based practice and interdisciplinary collaboration. By involving the physician and providing clear, factual information about GERD management, the nurse upholds their responsibility to ensure the child's health and safety. An incorrect approach that dismisses parental concerns without adequate exploration or education fails to uphold the principle of respect for persons and can erode trust, may also lead to delayed or inadequate treatment for the child, violating the principle of beneficence. Another incorrect approach that immediately escalates to child protective services without attempting to understand the parental perspective or provide support could be an overreaction, potentially causing unnecessary distress to the family and damaging the nurse-parent relationship. This may also be seen as a failure to exhaust less restrictive interventions. A third incorrect approach that solely relies on parental wishes without professional assessment and guidance disregards the nurse's professional responsibility and the established medical protocols for managing pediatric conditions, potentially leading to harm. Professional decision-making in such situations requires a systematic approach. First, actively listen to and validate parental concerns. Second, assess the child's condition thoroughly. Third, educate parents using clear evidence-based information, addressing their specific worries. Fourth, collaborate with the physician to develop a treatment plan. And fifth, document all interactions and decisions meticulously. This process ensures that care is individualized, ethical, and compliant with professional standards,